My name is Thuy Nguyen, a Vietnamese Canadian. Back in Vietnam, I was a medical doctor and working in internal medicine and respiratory medicine for 16 years. And I found that working in healthcare system is very rewarding in terms of giving patient care, giving the right diagnosis and treatments to patients. Immigrated to Ottawa, Canada in 2010, I was unable to come back to my previous career for some reasons. Despite a lot of challenges in setting up a new life, I committed my times as a volunteer and an interpreter at the civic hospital. With my passions in working in healthcare system, I decided to get into MRT program at the Nguyen College, Ottawa in 2015. After writing the entrance test, I was one of 41 students who was accepted into programs amongst approximate 700 applicants. I found that the Red Tech program is very interesting even though it's very tough and intense. Because my family is reuniting with my sister in San Jose this summer, I wanted to continue my studying in RadTech and become a registered RadTech in California. The great passion, responsibility, carefulness, knowledge, and experience in healthcare system are my strengths that I will bring in when I am in the medical RadTech program. I completed the 22 and a half clinical hours at the Civic Hospital in Ottawa, and I'm going to have my second clinical practicum for 1 month in May. I have found that RadTech is very interesting because I get to move a lot, interact with patients and with the other healthcare provider. The primary responsibilities of MRT is giving a perfect images with minimum radiation exposure, and this task is very suitable to my characteristics. I've observed and experienced some hands-on skill through the first clinical practicum of the MRT program. I recognize that the RadTech do a lot of imaging for different patients and different situations in the imaging room or in ER or on the floors. It was not only interacting with the patients but also with their family members, doctors, and other healthcare providers. In my opinion, it's very rewarding when you know you produce a good and correct image so that doctors can get a right diagnosis and the patient receive the right treatment that they need. Therefore, I truly want to continue to study in RadTech program and work in these fields in the future. I am a major student and ready for the program. I prepare myself in terms of finance and emotions for moving from Ottawa to California, established a new life for my family, and continue my study. My wife is a practical nurse who is totally supportive for my 2 years studying. I am ready, looking forward to start and continue what I am studying in Ottawa, so I can graduate, write license, and work in the field as a registered MRT. I am very positive about my application to Loma Linda University. My academic background as Doctor of Medicine, ECFMG holder, RadTech student make me be a suitable candidate for your program. Moreover, I found myself is a good student with remarkable grades. In fact, I completed the first semester with GPAs of 3.9. In addition to that, I am able to work independently and as a team member. I am always willing to learn and I am very detailed and precise in taking images for the patient. Last but not least, I am a Catholic with great passions in working in the healthcare field and helping people. All of those qualifications is the great motivation for me in studying and driving myself to become a successful RadTech. In addition, this is a milestone for me to go further to become a radiologist assistant in the future. Thank you for your listening, and I hope to see you in person at Loma Linda University. Goodbye.